Hello, I'm Dr. Dennis McKenna. I'm joined again today by Dr. Venditti, our hospital director. Today is Incident Command Day 30, providing you the update from Albany Med on the coronavirus. We have a lot to report. Let's jump right into the numbers. We report the numbers of positive COVID-19 cases in 5 counties: Albany, Schenectady, Rensselaer, Saratoga, and Columbia. Yesterday, that number was 726. Today, it's 754. So that's a pickup of 28 cases in those 5 counties since yesterday. However, as you'll hear, that is not translating into a pickup of 28 cases on the inpatient side. Let's take a look and see exactly what's happening here inside Albany Med. At Albany Med, we have 60 patients currently in the hospital with COVID-19. 30 are on the floor, 30 in the ICU. Of those, 25 are on ventilators. Now, you will recall yesterday we had 61. So this is the first time we can report that the number of inpatients has actually gone down. And in point of fact, when we talk to the area hospitals that you lead in the morning, Fred, yes, the number in the area is down slightly as well.
That's right. We're down about 4 cases area-wide.
The reason why our numbers are down today compared to yesterday is we had 7 patients discharged from the hospital yesterday. So that's very encouraging. I want to warn everybody that one data point is just one data point. We are still encouraging all the practices of social distancing, and we're going to continue to watch this very carefully, but it is encouraging at least that that number is down compared to yesterday. As always, we talk about our readiness of rooms, of ICU rooms, of ventilators, of staff. So, Fred, let me ask you a couple questions. I know that we have a tiered approach to readiness.
Yes.
What is our tiered status right now?
So, Dennis, we're still in Tier 1 for our med-surg beds, and we're in Tier 2 still for our ICU beds. So neither of those have changed since the last time we talked about this last week.
Wonderful. Staff. We have operating rooms that are collapsing down. We are not doing as many surgeries as directed by the governor. Are we doing anything special with some of that staff?
So Dennis, we've created a strategic redeployment group, and that group has really gotten legs yesterday. They've identified a number of staff members with very specific skills on the one hand that are needed elsewhere in the organization on the other hand, and they've begun to connect them. So, for example, the CRNAs that work in the operating room, most of them are critical care trained nurses prior to becoming CRNAs, and they are now going to be redeployed and help in the critical care areas. So that's just one example of the redeployment we're doing.
That's fantastic. And then lastly, you talked about the 3 S's when it came to PPE. What's the update on the 3 S's?
So I really want to talk about masks as it relates to the 3 S's. So you may remember that the 3 S's stand for safety, science, and supply. So let's talk about those as it relates to masks, and particularly inside the hospital as it relates to cloth masks. So safety really, I think, is a broad term that needs to cause us all to focus on things like social distancing, hand washing, staying out of crowds, covering our mouth when we cough or sneeze. Those kinds of things I think still are critically important from a safety perspective. From a science perspective, when it comes to masks, there is no good data that cloth masks in a healthcare setting make a difference. As a matter of fact, there's one study, a small study, that compared cloth masks to surgical masks. And in a hospital setting, those individuals that wore cloth masks had a 13-fold higher risk of getting a respiratory infection compared to the surgical masks. So from a science perspective, cloth masks probably don't make sense in a healthcare setting. And then the third S is supply. And we've talked about supply in each and every one of these videos. While our supply remains adequate, we need to use our masks rationally. And I don't mean ration, I mean rationally, where they're going to make a difference, where they're going to either protect the healthcare worker, our patients, or both.
That's great. Thank you. Great summary.
Dennis, yesterday we told the audience about the new testing site at UAlbany. Can you tell us a little bit about what's going on there?
I can. So to remind everybody, there's a new outpatient testing location. It's on the Colonial Quad at the University at Albany. The hours are 8 a.m. to 6 p.m. It started yesterday. I would like to thank our staff from Albany Med who are joining clinical colleagues from St. Peter's Health Partners in staffing that tent. We heard yesterday there was between 200 and 300 people that came through for testing. So while we're focusing on the numbers here inside the hospital, it's still very important from a public health standpoint to establish the prevalence in the community. Let me remind you the phone number is 1-888-364-3065. That's the phone number somebody would call if they think they want to, or if they might need to be tested for COVID-19.
That's great. And I would remind all of our staff, we still want you to come through our employee health services if you feel that you have symptoms that would require testing.
And I was over at our employee health today, and I was talking to the manager and the staff. They're very energetic. They know that they're playing an incredibly important role in this with not only N95 fit testing, but COVID-19 testing and respiratory evaluations on people. So thank you to our employee health service staff. They're doing a remarkable job as well. I'd like to talk a little bit about the practice today. We've talked about how very quickly the faculty practice here at Albany Med was able to offer up services for telephone visits and video visits. So I can report, Fred, these are remarkable numbers. So far, the practice has had 5,700 telephone visits. They have almost 4,000 more scheduled, so that'll be almost 10,000 telephone visits. And in addition, they now have 15 different practice sites that are offering video visits, and there's been about 260 of those scheduled.
That's fantastic.
So it's a great offering from the practice. So Emergent Care also has that video offering. So hopefully people can go to the website and be seen on the video with Emergent Care if they need to. There was an article in the New York Times yesterday, and the headline of the article is, "Where have all the heart attacks gone?" It was a very important article. We spoke about it, Fred. This is a very important message to the community. I'm an emergency medicine physician. Fred, you're a cardiologist. I think we both are concerned that if people have real medical conditions, they're not seeking medical care at an appropriate setting, and we want to encourage people to do that.
The hospital is safe. We are taking all the appropriate precautions around the patients with COVID-19. So if you're having something like chest pain or symptoms of a stroke or gastric distress that might be related to diverticulitis or any number of illnesses that either you have chronically or you're worried about, please seek medical attention. Don't wait at home. Waiting at home, if you're having chest pain and you happen to be having a heart attack, could create tremendous problems for you down the road. Heart failure and other very bad things. Things that could be addressed, dealt with ahead of time. So please, seek appropriate medical attention. Don't wait at home.
Great message. Let's end on this today. I was taking a walk with my children the other day through the neighborhood, and a neighbor reminded me that while social distancing is important, we should not socially isolate. It's still incredibly important from a human spirit standpoint to stay connected to other human beings. And so we want to encourage all of us listening, our employees and everyone else, please don't socially isolate. And we know that people are stressed. And for our employees, I think we want to remind them about what we have available to them.
So our EAP program, our Employee Assistance Program, is there for you. If you're feeling stressed, if you feel you need help, you need to talk to someone, go on the intranet. There's a site there. There's a way to contact EAP and reach out for help. Please do that if you feel you need it.
Great. Thank you. That'll do it for today. As the week goes on, we have some important updates to give both in pharmacy and lab, so we'll come back with that tomorrow or the next day. Thank you very much for everything you're doing out there, taking care of patients. And once again, we ask you, please take care of yourself, take care of each other, and we'll see you tomorrow.